Happy? Yeah. Okay, we'll get started then. It's always great fun when we take our daily COVID updates on the road, and today we're coming to you live from Seaworld. It's Seaworld's 50th anniversary, and over those 50 years, they've welcomed more than 50 million visitors. They are just a marquee of Gold Coast tourism, a great asset for our state. And even though the last 18 months have been hard, I'm sure they're going to bounce back bigger and better than ever. Of course, we put a special public holiday on this weekend, the People's Long Weekend, for folk in Brisbane and some of the surrounding local government areas, and many of them are here on the coast today enjoying the beaches and the theme parks. There are no new cases of COVID-19 in Queensland, just 17 active cases in total. We did 8,799 tests in the last 24-hour period, and Queensland Health administered 14,219 vaccines. Across Queensland, 76.55% of the eligible population have now started their vaccination journey by getting their first dose, and 62.39% are now fully vaccinated. Here on the Gold Coast, it's slightly lower. 74.5% of people have had their first dose, and 59% of people are fully vaccinated. And we have a message to people on the Gold Coast right now. We need more of you to get vaccinated, and we specifically need you to get vaccinated this weekend. We have pop-up clinics all over the place, including at surf clubs and at our theme parks right here at SeaWorld. So you can come along to SeaWorld, celebrate their 50th anniversary, and do your bit for the community, and in particular for the tourist industry, who really need those borders open. So our number one message, go and get vaccinated today. The Agriculture Minister, Mark Furness, here with me as the Minister for SeaWorld, as well as our Deputy Chief Health Officer, Lynn. No? Lynn?
Thank you, Deputy Premier, and it's a great pleasure to be here today. What a beautiful day it is here in Queensland. I would just like to, again, please urge all Queenslanders to go and get vaccinated if you have not done so yet. It's so important. This is our main defence against this virus. It's going to be what keeps us safe, will keep our families safe, and keep the people in our community who are vulnerable safe. We know that vaccine is very, very protective, and it's really great now that Queenslanders have got choices of which vaccine to have. I've had a few people ask me recently about the Moderna vaccine, and that is available now at 682 pharmacies across Queensland. So have a look on our website. You can go to our Queensland Health clinics in these great pop-up clinics this weekend, but all our mass vaccination clinics, our hospital and health service run clinics, your general practice or your pharmacy. So you've got a lot of choice. Please do take up the opportunity because it's so important. Thank you.
We're all happy to take questions.
Minister, having no show with the borders about to reopen is hardly an ideal situation, is it?
Look, it's sad that Dr. Hajkovic can't take up the role, but we are very well served by our Deputy Chief Health Officers, as well as the very substantial team that we've built around them through this pandemic. And so I'm very confident that with Dr. Peter Aiken acting in the role and the Director General moving quickly to find a new recruit for the ongoing role, we're not going to miss a beat. Queensland Health won't miss a beat. We have just a few more weeks now to start meeting those vaccination targets, and everyone is absolutely focused on that.
Deputy Premier, there's some early rumours this morning within New South Wales Cabinet they might exchange that what was first meant to be December 1 opening to double vaxxed, to no vaxxed, to now 95% double dose, which means New South Wales about 87 now, would be significantly before that December 1. Will that affect us in any way?
As we have all along, we've made decisions in the best interests of Queensland and Queenslanders. Of course, we look at what other states are doing because they have impacts on us and the risks here. And so if there are changes to the settings in New South Wales, we will look at them and look at what they mean for Queensland. We'll take the health advice and we'll make appropriate decisions.
How come Young wasn't asked to stay in the role for a little bit longer in the interim?
I think everyone agrees that Dr. Young has done her service for Queensland as Chief Health Officer and is very ready to take on the new role as Governor. Her appointment has been approved by the Queen, so all of that will go ahead on Monday, and Dr. Peter Aiken will act in the role of Chief Health Officer until a permanent recruit is appointed.
Are you going to embark on a new global search and will Dr. Palaszczuk return to his former position?
I'm not across the specific plans, his specific plans, but the Director General will make appropriate decisions about a new recruitment process. There were other candidates at the time, and there is a process by which the panel can either determine to go back to that pool or go out to recruitment again. So their decisions appropriately that rest with the Director General.
Was his decision to step away unexpected?
It was unexpected. He's asked that we respect his privacy, that it was a decision he made for personal reasons, and of course we respect that. He's a very, very good doctor, and I certainly hope that he continues to work with us in Queensland.
Minister, when were you going to announce the freedoms that unvaccinated people won't have when borders reopen?
Look, our absolute focus right now is getting people vaccinated. If everyone's vaccinated, then we don't need to make those kind of difficult decisions. But obviously, as those deadlines approach, there will be discussions around what other measures continue to be in place beyond those dates and even beyond the 90% threshold.
Is irresponsible that the government's going to choose to open the border to Victoria and New South Wales, and there's parts of the state that have a double dose rate of clinical vaccine?
Well, what Dr. Young said all along was that the key threshold for us here in Queensland was that everyone had an opportunity to get vaccinated, and I'm sure you would agree that by the 17th of December, given the lengths we've gone to get vaccination out and available in the community right across the state, everyone will have had that opportunity. And of course, we'll have met those thresholds, particularly 80%, where the modelling tells us that the impact on the healthcare system can be minimised, and we can continue to care not just for everyone who will get COVID, but for all of the other illnesses and injuries that people suffer. So this is a cautious and measured plan, but it is one that gets us open in time for Christmas, in time for families to get together again at Christmas time.
It's really been good enough that door-to-door vaccinations in remote Indigenous communities has only begun in the last month. We've had the vaccine since February.
Well, I'm not sure that's the case. I know in Pomperau they've been transporting people throughout the community to get them vaccinated right throughout the vaccination campaign. In some cases, door-to-door is not the most effective way to get people vaccinated, but in some communities that has been effective, and I'm aware that that's helped them to boost those vaccination rates. I trust our health staff in those communities and their community leaders to know what the best way to build confidence and get people vaccinated is, and that's why we appropriately allow them to make those decisions locally.
And throughout the pandemic, we were told that Dr. Young's job was the most important in the state. So Dr. Palaszczuk would have done, I guess, quite a significant handover with Dr. Young to move into that role. With the government selecting a new Chief Health Officer, is there time to have that handover, that process again, or will it all be sort of new processes for that?
Well, look, obviously it's not the outcome that we wanted. It's not ideal, but what we did at the same time is put a lot more infrastructure around the role. And so, when we started out in the pandemic, there were no official Deputy Chief Health Officers. There was somebody who took that title on, but it wasn't recognised under the law. Now we have 3 Deputy Chief Health Officers. We have a lot bigger team around the Chief Health Officers, and so we're much better placed. Those deputy chos, they're doing a great job. Lynn and the other 2 Deputy Chief Health Officers are doing a great job, and they've been there for that handover as well. So I'm quite confident that will allow for continuity in the advice that government receives, as well as in the work that Queensland Health does.
One of the deputies to step up. one of the deputies
Well,
to
so-
step up and do the role full time?
So that's the acting arrangement that we've put in place. There are rules in the public service about how these appointments have to be undertaken, and so that involves a competitive merit-based process, and that's what the Director General will now do. As I said, there are also processes for where the lead candidate declines the role. That allows the panel to then go back to the pool and see if there were other suitable candidates. So that's an option that the Director General will have, but they're his decisions to make.
Do you agree with Judy Spencer's time for a review of the Parliamentary Committee?
No, I think the parliamentary committees work very well. Clearly there are some times and some reasons why their business is best conducted in private, and that's a decision that they make. But I certainly won't be taking advice about our committee system from the LNP. All of our legislation, unless it's very, very urgent, all of our legislation goes through a committee process. Campbell Newman, when he was the Premier, bypassed the committee process for every piece of legislation that he personally determined was an election commitment. Even our election commitments still go through that committee process. They do a very good job, and very often we amend our legislation based on the advice of those committees. Just this week I've referred a very important matter to the committee that oversees my portfolio, and I look forward to their work.
Some of the tourism industry heavyweights, including Vikash from Village Roadshow, spoke on the Gold Coast yesterday. They're obviously really excited for borders to reopen when we hit that, I guess, December 17 and 80%. Once we hit 80%, does that mean the borders are open for good? They're not going to close again? And the same, I guess, for lockdowns. What would it take after 80% vax rate to trigger a lockdown?
Look, as we've said, that date of 17 December is our deadline. It's when we have to get 80% of people vaccinated, and that is the level at which the modelling says our health system can cope with the number of people who will get COVID. We want to provide certainty to tourism that is a date that is set. It will be no later than that. It could be sooner than that. If Queenslanders go and get vaccinated more quickly, that date could be brought forward. It does coincide with the start of school holidays, which allows people to plan their trips away. And I'm very confident, just seeing how many people are on the Gold Coast today with a public holiday in Brisbane, I'm very confident there's lots of people who've been waiting to get here, and will be making their plans now.
The government plans to reward businesses that are only open to fully vaccinated people.
Well, the roadmap said that businesses who choose to be open to only vaccinated people will be relieved of those other social distancing requirements that remain in place. So at the moment, places have limits in terms of the number of people that can be in indoor and outdoor spaces, that kind of thing. The roadmap embeds in it the opportunity for people to make that choice.
Will there be any restrictions at all? Sorry, will it be back to pre-pandemic life?
Well, I think the roadmap. You'd have to check the wording of the roadmap, Lydia, but I understand it says no social distancing restrictions. But check the wording of the roadmap for me.
The Premier had a teleconference with regional mayors yesterday. What ideas were put forward to boost vaccination rates?
So I wasn't on that call. I was at another event, but the intention of it was to go to those mayors with that we were most concerned about. You know, there's a wide variability from the average across the state, and so we wanted to go to those communities and see just what it is we could do, what more it is we could do to work with them to get vaccination rates up. I know from my visit to Mount Isa the week before last, they had already put a clinic outside Kmart. They said that was the place where everyone who came to town went, and so we had a clinic there. But they also said that the one person younger people in the town would listen to, particularly younger Indigenous people, would be Charlie Cameron from the Lions, and so he was there this week, Tuesday and Wednesday, to get that message out. And so that's the kind of thing we'll be looking to do, where mayors can provide advice to us about locations, about times, about hard-to-reach communities, and about ambassadors who will be able to get that message out. We'll take all of that advice on board.
Mayors from 19 communities, including Main Butcher from Lockhart River, pushing for new restrictions as Queensland borders set to open. Will the government listen to their concerns and requests?
We always listen to community leaders, but our intention is very much that this is the end of those kind of border-based lockdowns, and that's what we want to achieve. That's why we want to achieve that vaccination target. It's why we're working with those mayors to see them reach those targets.
Minister, the New South Wales is bringing in thousands of Pacific Island workers as early as next week. Is Queensland going to do similar, or look at similar spend?
Yeah, the Ag Minister can go into detail about the level at which we are already doing that, and we have pretty much throughout the pandemic, certainly since the middle of last year. So I'll get him to add. Of course, the facility at Wellcamp is the next phase of being able to bring in even more people, also from countries where we're concerned about the COVID risk.
Thank you. Yeah, sure. Look, it's a great question because we are in fact leading the nation when it comes to Pacific Islander workers in Queensland. On-farm quarantining, more than 4,200 collectively since last year, and we'll continue doing that. And a great example of what the government's done is come forward, work with the Wagner brothers up there at Wellcamp, building a facility that will have 500 beds before Christmas, a further 500 next year. Is a great example of how we'll work together, and not only students but ag workers, but returning Queenslanders to make sure they are well and truly served coming back onto our shores. So we'll continue supporting our state in terms of agriculture. We declared it an essential industry right from the outset, and we'll continue supporting our farmers and primary producers right across the state wherever you are.
At the moment, it's really the under 30 demographic that's really holding back the vaccination rollout. What's stopping you from saying, all right, in 3 weeks' time, you're going to need to be double vaxxed to get into pubs and clubs? What's stopping the government from doing that?
Look, understandably, that's quite an onerous requirement to put on those businesses, and so we have been consulting with them about the best way that we can put those kind of restrictions in place, and no doubt there'll be further announcements to be made there. But my message to younger people is, first of all, we understand. You know, for most of the vaccination rollout, younger people haven't been eligible. They haven't had the same window of opportunity. They're also a lot less likely to find themselves in healthcare settings where the vaccination program has largely been delivered. So that's why we're taking it out to them now, making it as easy as we possibly can. There's pop-up clinics at schools, at Bunnings, at surf lifesaving clubs, at theme parks this long weekend. And so we're just urging people to go and get vaccinated, and that's the best way they can ensure they have access to all of the freedoms. I mean, the one that we know about, the one that we can talk about now is the ability to travel. And if they aren't fully vaccinated by that date, they won't be able to travel. And if they want to be fully protected by that date, they pretty much need to get vaccinated this weekend. And so time's running out, the clock is ticking. Please go and get vaccinated today.
Yes, as well as got a building to its...
Sorry?
Do you have an update on Gerard Rahman? Have authorities been able to speak to him at all yet about what it's been?
I don't. Do you know?
New South Wales has got the vaccination certificate built into the check-in app. Is Queensland going to do the same?
Look, I understand we're working on the technology behind that to make it as easy as possible for people to demonstrate that they're vaccinated.
When will the police checkpoints be removed, and once they go, do you think they're going?
That's probably a better question put to police, and they'll be at other press conferences. Some of the infrastructure that they have there is easily removed and put back in place. I'm not exactly sure what their plans will be.
Is there a target you're looking at though?
In terms of removing the checkpoints, I'm not across those plans, but as I say, we'll have a deputy commissioner at one of these press conferences.
Would you like to see them removed for the ease of holiday makers coming up from down south over Christmas?
Yeah, look, obviously throughout we've always sought to minimise the impact on people while also keeping people safe, and our police are well placed to make those decisions. Thank you. Yeah, of course.
Yes.
This is all yours.
How well prepared is the Queensland health team